Microtia, an outer ear abnormality, affects 1 out of every 3,800 births and can cause hearing loss to babies as soon as they are born.
Dr. Quinn Orb, assistant professor at the otolaryngology department at University of Utah Health, here to share more on this condition in this sponsored interview. So, doctor, I'm not familiar with Microtia. What exactly is it?
So Microtia is a congenital, meaning children are born with it, deformity of the outer ear. And there's a grade system of 4 different types of microtia, ranging from just a little ear, which is literally what microtia means, to no ear whatsoever. So no outer ear. And it's also often associated with an absence of an ear canal. So no ear canal, which results in a maximal conductive hearing loss, so significant hearing loss for these little babies.
All right, how common is this in the U.S.?
So it's about 1 in just under 4,000, but in Utah, it seems to be a little bit higher rate. And that's because there's thought to be that there's some relationship with elevation, like in the Andes, we see higher rates of it. But that being said, it is relatively uncommon.
Relatively uncommon, but still higher rate here in Utah. So parents need to be aware of it. Doctors obviously are aware of it. And so usually this happens in one or both ears.
It's usually 1 ear.
Okay.
Yeah.
And then there are treatments too.
There are
thankfully,
treatments. Yes.
And there is hope out there. And walk us through some of those.
So the most important treatment when children are under a year of age or a little bit older is actually treating the hearing loss that we see associated with it.
And it can cause hearing loss.
Exactly, yeah. When there's no ear canal, then there often is hearing loss. And so we have a device that actually vibrates the bone and can basically help with hearing. And that helps with speech development, language, learning, all of that. So that's really important.
I thought it was interesting you say it happens more in males than it does in females.
Yeah, it's about 2 times more common in males.
Do we know why?
We don't know why. Actually, there's a lot of reasons behind it, but we're not totally sure what causes it.
So explain some of the treatments. So you go through a battery of tests to find out if your child has microtia, but there are some surgeries that can happen and the child can live a life with hearing.
Exactly. So usually the surgeries take place a little older, at 5 to 8 years of age. And there are 2 real options for reconstructing the outer ear. One option is you can use the child's own cartilage from their ribs to reconstruct the ear and basically carve a new ear out of the cartilage and put it under the skin. And then the other option is actually an implant. So you kind of make and solder an implant and then you cover it with soft tissue. And the other thing that you can do with those surgeries is you can create a new ear canal, or more commonly these days, we actually are putting in a surgically implanted hearing device to help. Almost like a cochlear implant, but not quite. It is a hearing device that vibrates the bone and stimulates the inner ear.
Are there risk factors? Are there things that moms-to-be out there can watch out for or do to prevent this?
Yeah, you know, that's such a good question. We don't really have anything specific that you can do to avoid it. It just seems to be, it's actually amazing that our ears form normally as often as they do, and it just somehow seems to happen. There are some genetic factors, but you can't really avoid those, and you really can't avoid living at higher elevations. So,
or maybe there might have been some trauma in womb. Is that a possibility?
There might be something about positioning in the early stages, but again, nothing that we can really treat for, unfortunately.
If it does happen, there is hope and there is help.
There is hope and there is help, yeah, if it does happen.
Because you do how many of these surgeries every single year?
It's not that common that we do the surgeries because it's not that common of a problem, but there is always hope and always help for patients who do have it.
And insurance covers the surgery.
They do, yeah.
All right, good to know, Dr. Orb. Thank you so much.
And our thanks to University of Utah Health, everybody. For more information, please do go to our website. We're great.